Hi, I'm Sylvia Gordon.
And I'm Rebecca Gordon.
We're talking today about Social Security disability. I know you don't want to learn about it. Your brain's already full. Drink the coffee, perk up. If you sell in the Medicare market, there is a huge population that needs your help, and they're very much underserved and misunderstood. And that is people that get Medicare under age 65.
And they get it early.
Due to disability. Yeah. How big of a population are we talking about?
You know, unfortunately, it's one that's continuing to grow right now. It's about 13% of the population.
Look at this. There's 66 million people on Social Security. Boom. 13% on disability. SSDI, or as we like to say, SSDI. Not to be confused with Social Security, Supplemental Security Income, or... forget.
I don't think we named that one just yet.
Okay, but this is survivors, widows, widowers, children. This is your retirees. Look at this big chunk that's under 65 that will be eligible for Medicare. Now, when you get approved for Social Security disability, do you automatically get Medicare?
After about 2 years, I think you have to be on Social Security for 25 months, but we like to say 2 years, and then you can.
So there are a few exceptions where they get it immediately.
Oh, if you have like dialysis or Lou Gehrig's disease.
Yeah, so like some people that are extremely ill get it immediately. So, but in general,
you have to be on Social Security for about 2 years.
2 years. 2 years. So,
which is important to know because that's a window, right?
Yeah,
that's important. That's number one thing to remember.
And look how many millions of people we have that we're talking about. Like over 8 million people that are on Medicare early. Now, the big problem is that they have all these misconceptions about Medicare. Number one.
They think it's free.
They think it's free.
Why not?
Right? They also think that it couldn't possibly be taxable income.
No. Which
it can. About half of people, it's married, it is also taxable. Or they think everything automatically happens. And in some respects that is, because they'll automatically be enrolled in Medicare. But then they don't automatically get a drug plan. They don't automatically get supplemental insurance. And clearly you don't want them, if they're on disability, to only have A and B. And a lot of them think that's all they're eligible for because that's what the government put them on.
Well, nobody talks about, Nobody can easily find this population, right? We can easily find seniors,
right?
You know,
we can buy lists of people's birthdays.
We can buy a list. We can just look at your hair.
You can be on disability at 28.
Right. God, that would be horrible.
Right? So you can be in your 30s, 40s, 50s. You can be on Medicare for years.
Yeah, they are so
okay. This is another misconception. People think that if they're on disability and they get married, they'll lose it. That's just not, yeah, it's wrong. They're confusing supplemental security income, which is a form of federal welfare, SSI.
Oh, okay.
For people that didn't, if you don't work long enough, you don't get disability. So it's like Social Security, pay to play. So if you didn't work long enough, you can get SSI. And if you get married, you always lose it. So the people on disability, they're afraid to get married. No, get married. They're also afraid to marry somebody that has any money. There's no asset and income limit on disability.
The only downfall would be taxes.
Yeah, but that's good. That's good.
Right.
It means you're making some money.
To qualify for disability, you have to be disabled.
Right. There's not an asset.
There's not an asset.
That's Medicaid.
It doesn't matter how much money your spouse has, or you can't work for 1 year, and you have to qualify, but it's due to a disability.
So it's very hard to qualify. On average, it takes about 2 years. Our best recommendation, if you have a client that wants to try to qualify, is to work with an attorney that specializes in that.
Okay.
They don't require money up front. They'll take it out of their back pay only if you're approved. So if they don't think you're going to get approved, they're not going to mess with your case. Every day I get asked, can I get disability? I have a lot of mental nervous. Can I get disability? I had somebody said they had scoliosis. I have scoliosis. Clearly a mental illness. Somebody said, can I get disability? I'm blind to one eye. I'm blind to one eye. I can work. But if you can't, if you can't work, I should apply. If you cannot work, it's not that easy. It's very difficult because look how many people are applying and the backlog and everything. But there's people in your community that are on disability that don't know where the Medicare component's going to come in. And this is very tricky depending on your state.
There's only about 10 states that have med sup plans approved in those states for Social Security disability underage.
Most states, it's a no-go.
So all those other states, what do? Buy an Advantage plan?
Med Advantage is your only option.
And know that it's your only out. I mean, you know what your out-of-pocket max is, I guess. I mean, there could, if you have a lot of chronic conditions,
I know it could be very expensive.
Very expensive.
Now you could stay on your spouse's insurance if you have a spouse,
Which would be
and
good.
then a lot of people get screwed up at that juncture too, because now they're at their 25th month. Social Security automatically enrolls them in Medicare, starts taking that money out for Medicare Part B, and they're on their spouse's plan. They don't need Medicare Part B. They don't need to pay for it, but they feel like, well, they started doing it. I have to do it, right? No, you can file SS Form 1173 and tell them to stop it.
How do people know, though, after that 25th month that they're going to be automatically enrolled? Are you saying you don't have to fill out any paperwork?
Nope.
For A or B?
No.
How does A or B know that you're disabled? How do they know?
Social Security.
So the SSDI is talking to Medicare.
Yep. So this is another thing that agents get confused about. Social Security and Medicare are kind of like the same beast, right? So where do you sign up for Medicare? SocialSecurity.gov. Medicare handles the health care part of it. All the administration part of it, change of address, signing up, all those forms, is handled by Social Security.
They're like twins.
I know. It's like
siblings. Interesting. So could you be subject to any late penalties?
So you wouldn't think that the disabled would get hit with penalties if they screw this up, right? They didn't sign up for Part D because they didn't know they had to. They get penalties just like everybody else. But when they turn 65, they get a brand new day.
They get an IEP.
So that's the thing that I've had, unfortunately, too many agents mess up. And I've done training seminars where agents are sitting in the back going, are you sure? I'm like, I'm sure. I train for a living. I'm sure. They're like, I screwed this up. I'm like, buddy, don't feel bad. Lots of agents screw this up. We have a lot of information to digest and a lot of constantly changing information. But this is something that universally agents mess up with because you don't typically get a lot of clients that are on disability. So then when you get them, you're kind of like,
And that's why, and no, not a slam on any agents. A lot won't try to tackle this market.
Right, because you're already busy. Your brain's already full. So
and there's more nuances.
And especially if you're a new agent, you're like, scroll.
Yeah.
No, come back to this video several times. Master this information because you know how it is. The next call is going to be somebody on disability and you're like, dang it, I scrolled past their video. So disability, over 8 million people need help with Medicare. They get a brand new IEP. So let's say you got disability at 50 and you were in Georgia, Tennessee, Oklahoma, Indiana, Ohio, and you couldn't get a Medicare supplement and you had a very chronic, expensive condition, so you got a Medicare Advantage. Now you're turning 65. What happens?
I can get a med sup.
And you want a med sup.
And I want a med
Even
sup.
though you might not be able to hold on to it your whole life because of the price.
But for right
You
then
want to
and
get
now,
it for as long
Yeah.
as you can get it. And limit your out-of-pocket for as long as you can. There's a lot more to disability than this 5 minutes. So if you have more questions, ask us in the comments below. And Subscribe. We have great content every week. And all we ask is just for you to hit that follow button. It's free training. And you know you didn't know this stuff. You know you needed it. Hit the follow button. That's the only thing we want.
Actually, we really want you to put your business with us, okay? Because I know you're with somebody else, those of you.
And they didn't tell you about this.
You
This
just
is
love
critical.
us.
This is
You guys are
critical
so
information.
funny. Come on. Seriously?
See you next week.
Later. Bye.